Thank you, Mr. Speaker. To the bill.
To the bill.
Colleagues, since the first time I spoke on this House floor to support Medicaid funding, I have been talking about tobacco tax. You see, colleagues, it's because I've been talking about tobacco tax for a decade. This conversation didn't just start as a legislator. It started as a nurse who cares deeply about her patients. A nurse who knows a tobacco tax indeed discourages our youth from ever starting to smoke, and it definitely encourages those who have started to quit. So in fact, it will help people quit. The price will be cost prohibitive. I am so excited to stand with nurses across the state in support of House Bill 2270 to increase the tax on cigarettes and finally implement a tax on e-cigarettes in Oregon. Ultimately, I am tired of seeing my patients, too often the working poor, who are targeted by big tobacco in their youth, die premature and painful deaths because of the impact of tobacco. This weighs on me every day. And it also ultimately weighs on the state. Currently, the Oregon Health Plan spends roughly $374 million a year just treating tobacco-related illnesses. Meanwhile, the big tobacco industry is profiting at unprecedented rates. We know that the best way to deter access, particularly for young people, is by raising the price. And yet Oregon currently ranks 32nd in the nation in cigarette taxes and leaves e-cigarettes totally untaxed. It's time that we as lawmakers stand up to big tobacco. Not only have they spent millions of dollars to target communities of color, tribes, and low-income folks over the decades, they are now using the same playbooks to target youth to use e-cigarettes like Juul. It's time that we hold them accountable to their actions. House Bill 2270 will be reinvested into these target communities by contributing already invested funds into the Oregon Health Plan, as well as into culturally specific organizations, tribes, and to cessation and prevention programs across Oregon. The bill is a critical opportunity to help fund programs that millions of Oregonians rely on, but it will also have a direct impact on the health of patients like mine. Smoking is still the #1 cause of preventable death in Oregon. I'm going to repeat this. Smoking is the #1 cause of preventable death in Oregon. Studies show that this proposal will prevent over 19,000 kids from ever taking up smoking and help 31,000 Oregonians quit. I came to Salem to help Oregonians live healthier lives through access to affordable health insurance, but also by improving all the structural pieces in our society that have a huge downstream effect on health. As a nurse practitioner, I have an obligation to use every tool in my toolbox to try to prevent my patients, our constituents, from pain and harm. It's time that as a state legislature, we take on that same obligation. House Bill 2270 is a thoughtful and common sense tool for making sure that tobacco use is no longer the leading cause of preventable death in our state. I strongly urge your aye vote. Thank you.